Hello, everyone. Thank you so much for joining us for this edition of Talkin Kids Health. I'm Beatriz Canals. Today we are discussing genetic testing and the very important work being done at the Victor Center here at Nicholas Children's Hospital. So I want to ask all of you joining us now, please, if you have any questions pertaining to genetic testing, please send us your questions now right here on Facebook Live, and hopefully we'll have your questions answered by Dr. Saima Aftab, who's joining us today. Thank you for joining us again.
Thank you for having me.
You are the PSA Chief for Neonatology and the Field Care Center here at Nicholas, as well as the Director of the Victor Center for the Prevention of Jewish Genetic Diseases at Nicholas Children's Hospital. Tell us, if you will, about the Victor Center and how did it originate? How did it get started?
So the Victor Center was created in 2002 by Mrs. Lois Victor, and she was a Philadelphia resident and a big active trustee for the Einstein Health System. And unfortunately, she had two little girls, two daughters, that suffered from a condition called fetal dysautonomia. And with that condition, her daughters were very sick. They had to be in and out of the hospital. They didn't grow very well, and eventually ended up passing away. And at that time, it wasn't known that this was a genetic condition that was inherited, and the gene was not discovered yet. So she made it her life's mission to really understand preventable Jewish genetic diseases. And then eventually in 2002, the Victor Center was created specifically to create awareness amongst the Jewish community, as well as provide a venue for preconception genetic testing to see if you're, for any of the people of childbearing age, if they're carrying a gene. And if not, now today, not only tests for the condition that Mrs. Victor's daughter suffered from, but also in addition to 100 inheritable diseases.
And the program is actually a national program, and it's chosen Nicholas Children's Hospital to be its headquarters. Why Miami? Why is it such an ideal location?
So we're very, very lucky because, for one, because the heart and soul of this program was in the diagnosis of inheritable Jewish genetic diseases. We are a very big hub for, for the Jewish faith. So after cities such as New York and LA, there's a very large Jewish population and a very large Jewish community that's very active in Miami. In addition to that, we are a perfect site to patients and families that are living in the South Americas and travel and tourism as well. So we just open doors for many more families to get tested and more information. So in about a year ago, we became a national site, but we have over a dozen affiliate sites with the Victor Center across the country. So what we provide now as being the center, the hub for the Victor Center for Prevention and Diagnosis of Jewish Genetic Diseases, is we can actually set the tone for what the education could look like, outreach into the community. So we actually help run the center in collaboration with affiliate sites. So I think it's a great matter of pride for people living in Miami, and it's a great opportunity for a lot of families that live locally and also for families in the region.
And when we talk about the help that's being provided at the Victor Center, aside from genetic testing, in addition to, there's also an incredible help that you do in the community by way of education, awareness. You mentioned it. It's not just the genetic testing. Tell me about that.
So it's very interesting. A big part of the mission of the Victor Center is to create awareness. And create awareness not only in Jewish communities, but in everyone of childbearing age. So if you are single or married or thinking of having kids in the future or currently have kids, getting information about your carrier status, whether you're carrying in your genetic code some differences in your gene that could put your future children at risk for having a genetic condition, it's very important to know. It gives you a lot of information to prepare you, and there's a lot of different ways of approaching your pregnancy where you can have a happy, healthy baby.
Knowledge is power, right?
Knowledge is absolutely power. So we partner through the Victor Center with a lot of Jewish community centers, with rabbis, but also with women's groups, with universities, any place where we see children, people of childbearing age, 18 and older, and we help answer questions. We provide counseling services in addition to genetic testing as well. So it's a very comprehensive program in that way, and it's a key service to the community.
It's wonderful. When we talk about the genetic testing, you get so much, you are able to provide so much information with what is considered, I understand, pretty simple test. Talk to me about what the test is like.
So the testing has evolved. So in the 1970s, when testing first became available, there was only one condition you could test for. It was taste size. And it's a blood-based test. It would take a long time to come back. But now, from a simple saliva-based test, so pretty much, you just need to spit in a small vial, you are able to get information for over 200 diseases that can be inherited. And it's interesting that as healthy individuals going about our way, we do carry some differences in our genetic makeup. So we may be carrying a genetic difference or a gene mutation, so to speak, for many generations and not know it. So it's important for us to be aware, because if we have a child with a partner who also happens to carry that mutation, which can happen now, it can lead to your child having the chance of having two copies, which may affect your baby in the future. So just having the knowledge and information and knowing what it means and to get tested will be a huge service to the community.
You mentioned over 200 diseases that can be detected, so I won't have to list them all, of course, but if you can, tell us about some of the more common ones that are detected.
Absolutely. So the list is very long. So now every single day more and more genetic information is becoming available and the ability to test is actually expanding. So I wouldn't be surprised in another year or so if our panel even expands larger to include even more diseases that are less common. But some of the top of my head would be Tay-Sachs disease that people sort of think of when they think of inherited diseases that traditionally run with some frequency in Jewish communities. In addition to that, cystic fibrosis is something that a lot of people have known about or heard about as an inherited condition that can cause children to be very sick. It could be severely affected. Gaucher's disease, a number of metabolic diseases. The list is very, very long.
And who is a candidate for the testing?
So essentially, anyone who's 18 and older. So if you're a young woman or a young man, if you're thinking of having children in the short-term future or in the long-term future, or if you're just curious about your heritage, and it doesn't provide ancestry information, but sometimes people are adopted, so they don't know if there's a family history of inherited genetic disease, so it's important for them to know as well. In addition to that, we often offer it to families also currently we have a child who has a chronic medical condition, something that, we want to know if there's a genetic basis for that. So providing families this information, testing both the parents can actually give us, important information to see whether the condition in their current child was something that was inherited, but also for the future pregnancies to make sure that, the inherited condition does not be passed on.
That makes sense. That way they can make that decision with the knowledge on their side.
Yes.
That's a possibility. And I understand that when it comes to the testing, how do they go about, if someone is watching this right now and they're interested in having genetic testing, what's the process? How do they sign up?
It's very simple. So we have on our website, there is a number you can call. We have genetic counselors that will connect with you, they'll counsel you, they'll explain exactly what the testing entails, what it involves. And it's a very simple procedure. You can either come on site and you can do testing in addition to counseling when you're available, or we can send you the kit in the mail and with instructions how to send the specimen for celebrities testing. We also do a lot of community events. So, there's a whole running calendar for events in your community, whether you go to university or go to a local Jewish center or to a synagogue. There may be a running calendar of events where you can just come to that event, participate, learn more about the center, and also get tested as well. And the really nice thing is that once your test results become available, our genetic counselors will give you a call back as soon as those tests are available. We actually talk you through what it means, and we're happy to set up a follow-up appointment so people clearly understand what the results mean for them and the implications.
Oh, that's wonderful. So you won't just drop it on their lap and not explain
exactly
what it all means, but walk them through it.
Absolutely.
And by how long does the testing take? When will someone get the results?
It's quite quick. It's about 2 to 3 weeks. And our team is very prompt at getting back results to families as soon as it's available. And it's that they also get a printed copy of the test results, so they have it with them. And sometimes for families, they're not thinking of having a baby right away, so it's important for them to have this information. But we stay in touch with them and we stay in contact with them. So if they have any questions in the future about it, we can always provide information in that setting as well.
Excellent. Anything else we'd like to add for anyone watching now that's interested in genetic testing or wants to know more about the Victor Center?
So I would say that it's we're very excited that this program is now run and centered at Beatriz Children's Hospital, where it integrates very nicely into other services that we have here. I did speak before. We had a similar session where we talked about the fetal care program.
Yes.
So it ties in very nicely. So we sometimes walk families through the pre-conception genetic testing to the journey of having a child that may be high risk and preparing families and getting them to the point of planning to care for a child that may be medically complex, and for some of them we help counsel them to know what their different options are for the future they're happy with the child. And getting testing is very simple now. It's just it's really incredible how quickly the field has evolved now. This information is just so easy to have. And knowledge is power, like you said. The more people get awareness about their own gene carrier status, what diseases they may or may not harbor, it would just give a lot of opportunity for us to have healthy kids for the future.
And making informed decisions.
And it's just great to have the service in our community. And we're here to help you If you have any questions, please send them our way. We're happy to answer them. We're available. Our genetic counselors are fantastic, and we're able to answer any questions. And also, we partner with our OBs and OB physicians and maternal fetal medicine specialists in the community to go and provide outreach. So you may be hearing about this in the setting of your obstetrician's office or your pediatrician's office. So we're very much integrated with the community because this is a service for the community.
What I noticed in the time I've been working with Nicholas Children's Hospital, there's another example of that, is that you're truly focused on helping the parents from beginning to end, like truly walking the journey with them in different conditions, different circumstances. But I always see that focus.
Absolutely.
You really want to walk everyone.
The phrase that we use is from conception to college, being with health and wellness. We're not in the business of illness, we're in the business of health and wellness. So we want you to be happy, healthy, yourself, and have children that live a very happy, healthy, productive life and can give you gray hairs when you're teenagers.
I'm there now. They're right back here. They're hiding. I know, we're both there.
Yes, we're both
know
there.
What the teenagers are all about. Thank you so much, Doctor, for joining us.
It's
Always
my pleasure.
a wealth of information.
Thank you for letting me share the story of the Victor Center. And I'm very, very proud to be part of it.
And I'm very happy to have it here in our community. We all are. We want to mention to all of you, if you do have questions and you weren't able to get them in now, but you're still left with those questions or want more information, all you have to do to schedule an appointment as well is visit the website, nicholaschildrens.org/Victor Center. And all of the information will be right there. Again, some counselors, wonderful counselors at the Victor Center, and doctors who are waiting to help you. Thank you, Doctor, again for joining us.
Thank you so much.
We hope you'll join us next time on Talking Kids Health. I'm Beatriz Canals. Stay happy and healthy and have a wonderful day.
Thank you, Doctor. Yes, thank you for having me.